All right. Good afternoon, Miss Holt. How are you doing?
I'm doing good.
Okay, so we're going to ask you some questions about your experience with the Jiffy Knee. To begin with, have you had both your knees replaced?
Yes, I have.
Okay, and when were your knees replaced?
The first one was in February, and the second one was in June of 2018, both of them.
Okay, and overall, how was your experience with the knee replacement?
Wonderful.
Okay.
I wouldn't go back to it like I had it before.
Good, good. And in terms of after the knee replacement, what were you using when you were discharged from the hospital? Were you using a walker or a cane or nothing?
Well, I had both, but I really didn't use them.
Okay, so you really weren't using a walker or a cane?
Right.
Within a week, would you say, or less?
Less.
Okay. How about stairs? Did they make you go up and down stairs before you left the hospital?
Yes, I did that with no problem. When I got home, I have 3 steps up into my kitchen, and I could do those without a cane.
Okay. And that was how many days after you stayed in the hospital?
3 or 4.
Okay. And in terms of pain medication, normally you're prescribed opioid or narcotic pain medication. When did you stop taking or requiring opioid narcotic pain medication?
Well, just to be safe and not let the pain flare up again, I started taking it in the hospital, and I stopped about a week after I got home and was not having any pain, just took it to be safe.
Okay, so within about a week you stopped taking all pain medication or a prescription pain medication,
That's right.
correct? Okay. And did you have any staples or stitches or anything to take out of your knee?
No, it was
Okay.
glued and had some tape over it and healed up wonderfully.
Okay. Can we see your knees and take a look at your knees here?
Sure.
And can you tell us when each one were done?
This one was in February 2018. This one was in June 2018.
Okay. Can you just take your finger, because it's sometimes hard to see, go ahead and show us your incision line with your index finger.
Okay, from here to here, as you notice, it's off to the side, and from here to here.
Okay. In terms of your experience, have you seen other patients who've had a knee replacement done the traditional way where the incision is in the front of the knee?
Yes, my brother did.
Okay, and how much difficulty did he have with the traditional knee replacement?
The knee replacement went well, but his recovery time was unreal compared to mine. If you have looked at the website, you can see Roy Griffin, that's my brother, and he's the one that had it the traditional way. And then watching me do so well, he made the decision to come to Virginia from Kentucky and get his done, and he couldn't be happier. Things have gone great.
Okay. And how about other patients locally? Have you noticed your friends or anyone else that have had it done the traditional way versus the Jiffy Knee?
I have seen some, but I don't know them personally.
Okay, okay. What are your words of wisdom for the total knee experience?
Oh my goodness. You don't hardly know where to start. It's so great. It is. I said if I had a third knee, I'd let Dr. Patel do my third knee, but the experience was just that good. It was not bad at all. The hospital personnel were wonderful. And so all the way around, Dr. Patel, his nurses, his PA, everyone has just been great. And it's just a good experience.
All right.
If you gotta have surgery, that's the best kind to have, because if you're going to do the other knee surgery, I know from my brother you'll have about 3 to 4 months of recovery time that the doctor wouldn't want you to do anything hardly. So I've been doing anything I wanted. My second week out of hospital with my first knee, I went to church in Suffolk, and I live in Cortland. And I drove to church, and when I got there, I played the organ, which for the left leg is a lot of work. So I did fine, did great, drove back home, so everything went good.
So you were driving within 2 weeks of your surgery?
Yes.
Okay. All right.
I really drove in about a week because I drove myself to therapy. I was doing so well. I told my kids not to worry about me. I could take myself, and that's what I did.
All right. Wonderful. Thank you.
You're welcome.